We are focusing on sputum, throat, and nasopharyngeal specimen collection for the phlebotomy exam. These non-blood collections are critical. An incorrect technique is a major reason for test failure and incorrect patient diagnosis, making it a heavily tested area. First, let's tackle sputum collection. The most important concept the exam will test is your ability to distinguish between sputum and saliva. Sputum comes from a deep cough originating in the lungs and is necessary for diagnosing conditions like tuberculosis or pneumonia. Saliva is just spit from the mouth and will result in a rejected sample. An exam question might describe a patient handing you a clear, watery fluid in a collection cup. Your correct response is to politely refuse the sample and re-educate the patient on producing a specimen with a deep, productive cough. Another key point is timing. The best time to collect sputum is first thing in the morning, before eating or drinking, because respiratory secretions and potential pathogens have accumulated overnight, leading to a more concentrated sample. Next, we have throat swabs, most commonly used for rapid strep tests. The exam will focus on the precise anatomical targets and areas to avoid. You must swab both tonsillar pillars and the posterior pharynx, which are the key areas where the bacteria reside. A common exam trap involves contamination. If the swab accidentally touches the tongue, teeth, or inside of the cheeks, it is contaminated with normal oral flora and must be discarded. A new sterile swab must be used to collect another sample to avoid a false negative result. The exam might present a scenario where you touch the tongue and ask for the next best step. The correct answer is always to get a new swab and repeat the collection correctly. Finally, let's discuss the nasopharyngeal or NP swab, which became very common with testing for COVID-19, influenza, and RSV. The exam will test your understanding of the proper depth and technique. An NP swab is not a simple nasal swab of the front of the nostril. It requires inserting the flexible swab straight back, parallel to the nasal floor, until you reach the posterior nasopharynx. Once there, the swab must be rotated and held in place for about 5 to 10 seconds to adequately collect epithelial cells and secretions. An exam question could describe an incorrect angle of insertion, such as aiming upwards, or a collection that was too brief, and ask you to identify the error. Remember that patient discomfort or gagging can occur, but this does not mean the procedure is being done wrong. To help you remember the core principle for all three of these collections, use this simple phrase: go deep, not wide. For sputum, you need a deep cough, not a wide mouthful of saliva. For a throat swab, you go deep to the pharynx, not wide to the cheeks and tongue. For an NP swab, you go deep into the nasopharynx, not just the wide opening of the nostril. This mental shortcut will help you select the correct procedure and identify errors in exam scenarios. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.